Welcome to Two Pete's in a Podcast, where we will talk about child health from birth right away through to adolescence, dealing with issues of illness, development, and everything else that is of importance. Hello and welcome to Two Pete's in a Podcast. I'm here with my colleague Michael Platten.
Still here. Hello.
Hi everybody. So we thought about talking about conjunctivitis, more affectionately known as pink eye. So how do you get a pink eye? Well, the joke I always make to patients is, they'll come in with a child with a red eye and say, "Is this pink eye?" And I'll look at the eye and go, "Yes, it's pink." Because you're going to get pink eye from sticking your finger in your eye.
Yeah.
Anything that causes the lining in the eye to become swollen is going to go pink. So it's a bit of a, we'll try and unpack that. So what is conjunctivitis? Well, conjunctivitis is inflammation of the conjunctiva. The conjunctiva is the lining in the nose that lines...
In the nose?
Oh, goodness gracious. Yeah. So it's almost like a George W. Bush, that, wasn't it?
Yes.
It's the lining of the eye that lines the inside of the eyelids, and then it covers the white of the eye. So the white of the eye is called the sclera. The colored part is called the iris, and the black part is called the pupil. And then covering the iris and the pupil is that dome structure called the cornea. And then the lining that is from the edge of the cornea around the rest of the eye is called the conjunctiva.
So after that amazing anatomy lesson, what you're getting at is the sensitive part of the eye is the conjunctiva.
Okay, sure. So if you stick your finger, okay. Well, the cornea is...
Like a sensitive part plus that.
Okay.
All right. Yeah, so as you get irritated, those blood vessels get bigger.
Yes.
They get more numerous
Yeah.
and start going forwards.
Yeah. So if you get a piece of dust in your eyes going to go pink, and it'll be a conjunctivitis. If you get a virus in your eye, and lots of viruses will cause conjunctivitis. You can get bacteria in your eye that cause conjunctivitis, but they generally cause conjunctivitis with mucky, mucousy stuff. And if you get any kind of irritation in your eye, if you get some soap in your eye, or God forbid something worse.
And allergies.
That's the one. So I think that covers it. So it's foreign bodies in the eye, it's irritants in the eye, viruses, bacteria, and allergies. So chlorine, swimming pools, for example, red eyes, we know that. So what's the approach to that then, Mike?
Right. We need to see what else is happening around the eye. So is the child also sick at the same time? Do they have a runny nose, sneezing, coughing? Because often if you have an infection in the sinuses, the eyes will also look glazed and watery and slightly red. Whether they have a discharge or not, that is sort of dictated by how profusely or how much the body actually responds to it. Like with viruses, you don't get that much gunk. There's more watery, and that can stick your eyelids together in the morning. But normally your bacteria causes a very large amount of pus being produced, and that's what sticks it together. It can be yellow, green, or white. Normally just clean that away, and it helps to at least cosmetically make it look better.
Exactly. And in fact, if you pull the eyelid down, the lower eyelid down, you'll actually see yellow mucus sitting in that kind of crypt between the eye and the eyelid. That's how much there is. And I think we must just, we talk about, you said in the morning. So you get normal sleep in the eye, which is just like normal mucus.
That white stuff.
Yeah. And you kind of shake it out your eyes in the morning. If you have little babies, they will very often have mucus in their eyes, and that's because their tear duct might be a bit blocked. Now, that doesn't mean that's an infection. So that's important.
If the eyes will be watery continuously.
And the eyes will be white.
Yes.
So if the eye is red and there's yellow mucus and it's a little baby, then yes, there is an infected conjunctivitis, an infected pink eye. And I think that the distinction here about why we're talking about there's a pink eye and then there's an infectious type of pink eye is that what's nursery schools particularly will send children home because there's pink eyes and they'll arrive in the office going, "Does my child have pink eye?" I mean, yes, you make a joke about the terminology, but what the moms are actually asking is
there an infection?
Yes, and is this contagious? So can my child go back to school again? So what do we do about it? How do we treat these things?
So normally, like if there is a suspicion that there is a bacterial infection, we will put eye drops in.
Yes.
And there's lots of different ones. And normally we'd throw it into that, you say, the crypt or the pocket underneath the eyelid on both sides. We always treat both sides. We don't ever treat only one eye, because there will be a time where the child will rub one eye and take it across the other eye, and then, hey, you just cleared one eye and the other one starts. So we always treat both eyes. In terms of viral infections, we can't really treat that.
Yes.
We need to give it time to get better. And in the interim, you just keep the eye nice and clean as best as possible. Wash it out with like salt water. Not like, that's not burny because it's so salty.
Like normal saline.
Saline, yes. And if it's an allergy, we treat the allergy. You can either treat it in the eye directly. They have eye drops that will treat an allergy. But if you're having a more systemic allergy that's affecting the sinuses and everything, you can also give an oral antihistamine.
And very often you could put the drops up the nose, because the nose, because it gets up the nose, gets up the tear duct into the eye. So there are specific allergy eye drops, like antihistamine type eye drops, that will work very nicely. And they work beautifully even for young children, because they're not absorbed into the body. They just work in the eye. Mm-hmm. If you've got a viral conjunctivitis, like the nasal decongestants that we use to try and help the nose when children have colds.
Like oxymetazoline.
Oxymetazoline. They make eye drops with oxymetazoline in, and they help to take away some of that irritation too. But remember, when the eye is inflamed like that,
it's tender.
It's sore. No matter what you put in there, it will initially be painful. And when the children have bad conjunctivitis, it actually can feel like there's sand, like grits. The older children will tell you there's something in my eye. Yeah. And when you examine it, you can't actually see a foreign body, but it's so inflamed, it feels gritty and sandy in the eye. It's very, very uncomfortable.
And sometimes, like for the older child, we can actually flip the eyelid back on itself and have a look underneath. And it has what we call follicles. Yeah. And it is the lining of that, or the conjunctiva, and underneath the eyelid is rough, and that's scratching and causing irritation.
Yeah. So that's why sometimes if the conjunctivitis is particularly bad, and if it's bad on one eye, it's quite a good idea to put some cream rather than drops into the eye. So you kind of squeeze the cream onto the inside of the lower eyelid, close the eye, and then actually patch the eye. So they're not blinking all the time, because it can be blinking sore.
Mm-hmm. Okay. Right. Trauma or foreign bodies. We need to obviously get that foreign body out. And often time will help.
Yes.
And I say that because my 4-year-old threw sand into my 2.5-year-old's eyes the other day, and I was still getting sand out of his eye 2 days later.
Yes.
It just takes time.
But eyelashes in your eye. I had a young girl just 2 days ago who was at netball and went to catch the ball and stuck her own finger in her own eye. And she immediately got such severe spasm of the eyelids that she couldn't actually open her eye. And I was immediately said to the mom, she's damaged her cornea, which is different from conjunctivitis. But if there's a foreign body in the eye and the eye is extremely painful that the child won't open it, it must be properly examined. Then you actually have to stain the eye with some little drops, and you can actually see the little erosion on the cornea. So that's a bit of an aside, but it's an important thing to look at. Very important. And try... a lot of the eye drops that you have available have got cortisone in them, mixed with an antibiotic. If you're treating a bacterial conjunctivitis, you don't actually need the cortisone.
Yeah, because it responds very, very quickly.
Yeah, and I certainly would not be trying to get that kind of stuff over the counter or using it for long periods of time. If we're having to use drops like that in the eye, I'd rather let your healthcare provider have a really good look and examine.
Yeah. And we also need to talk about the classification or the distinction between one eye being affected and 2 eyes being affected. Often, if only one eye is affected, you're looking at either a foreign body or irritation in that eye and a bacterial infection, because bacteria often cause infection in one eye. It can spread across the other one, but normally there's a delay between the two. Your viral infections can affect both eyes together at the same time.
As do allergies.
As do allergies, yes.
And they both have very watery discharges. And with an allergy conjunctivitis, the eyes are going to be very itchy rather than painful, which will give you a clue to the allergy.
Yeah, and scratchy.
Yeah.
More scratchy than not. And then the other thing is that you can get a conjunctivitis that is bloody. And I haven't actually seen this. Have you seen?
Yeah, a few times.
Yeah, and that is normally caused by, like you said, Simon earlier to me, adenovirus.
Yeah, adenovirus is a virus that causes, like any other of the respiratory viruses, just about anything, snotty nose, coughs and colds.
Diarrhea, vomiting.
Yeah, but it also, interestingly enough, can cause a bladder infection that is hemorrhagic. So you actually wee out blood. And if it's if it's adenovirus in the eye, the conjunctiva looks like raw meat. It's horrible. And you can even get like little skins that form inside the conjunctiva where you actually have to get somebody to peel them off. That can be terrible. So that's very important, that if your child's a bit ill, snotty nose, a little bit feverish, and gets a really bad red conjunctivitis, you must have it checked out because that must be followed very carefully.
Yeah, but this is hashtag more on the rare side.
Oh, more on the rare side, absolutely. I mean, I've seen it, 5 or 6 times, but it's around.
And when it's there, it's like, oh.
It's horrible.
So concerning features of conjunctivitis?
Yeah. So I think that's severe pain for me, number 1. Number 2 is if it's red and pussy and you start to get any swelling of the eyelids or any swelling of the skin around the eyelids.
What we call a periorbital cellulitis.
Exactly. If you have what looks like a pink eye of any description and the child is feverish with pain, that's unusual. Headaches. If the eyes are painful and they can't open them or moving the eyes is sore.
Disruption of vision.
And vision, blurred vision. So blurred vision would suggest it's more than conjunctivitis.
And the other thing is not responding to treatment.
Absolutely.
Oh, wait, hang on. And the other one, if you're concerned.
Always.
Yes, always. A little adage. But I think that's covered conjunctivitis.
Happy. Yeah.
Very happy. All right, if your children have allowed you to, thanks for listening.
Goodbye. Thanks for listening. If you found this of value, please be sure to sign up to our email list at www.careforkids.co.za, and that's the numeral 4, and subscribe in your favorite podcast app or follow us on Facebook.
At 2 Peas in a Podcast.
At 2 Peas in a Podcast.
TWO, not the numerical 2.
This is our disclaimer. The information we have given you in this podcast is our own personal professional opinion. We're giving it to you for your own information. Please don't use it to treat yourself or to treat anybody else. Rather, go and see your own medical healthcare provider and follow their advice.